This is a video segment. Patient referred for a mass in the umbilical region. Now this is the cervix of the uterus. This is the cervix. This area, this is the vagina. Patient's age is 40 years and is still menstruating. So this is the cervix, which measures 5.7 centimeters. This is the urinary bladder in longitudinal section. This is the anterior segment of the uterus. This is the fundus, and this is the posterior wall of the uterus. Okay. So this is the anterior wall, posterior wall of uterus. This is the endometrial canal. This thin line that you are seeing is the endometrial canal, which is in the very early proliferative phase. Now let's take the length of the uterus in total. It measures 11.7 centimeters in length. Normal we accept up to 11, we take as normal. This is also normal. I will not consider it as an abnormal. And in anterior-posterior diameter, this one, it measures 4.25 centimeters with this being the urinary bladder in longitudinal section. This is the uterus, fundus of the uterus, anterior segment, anterior wall, posterior wall, and this is the cervix. So the uterus is slightly enlarged in length, which is not to be considered as abnormal. This is the longitudinal section. Now when I move the probe a bit laterally, I see a heterogeneous area in the posterior wall of the uterus. Anterior to which lies the endometrial canal. This is the fibroid hypoechoic area in the posterior wall, and here you see a tiny slit-like area. This is the endometrial canal, this is the fundus of the uterus, this is the anterior wall, and in the posterior wall we are seeing a 25 into 17 millimeter hypoechoic area with no posterior wall enhancement. No calcification is seen within this. Its outer borders are ill-defined, and this is a posterior wall fibroid in this patient. Uterus. Similarly, as I go further upwards, I come across another worldly appearance structure, which is the fibroid again. This is the boundary of the fibroid. It's well demarcated. You can see its posterior wall. Now this is the echogenic area. This is a small cystic area within it. This is a hypoechoic area. So it's a sort of a complex mass, which is a fibroid. Anyway, its posterior wall can be seen. There are no calcifications within it, and the outer wall is well demarcated. सब कुछ देखा पहले मैं देखे ही उसने So this is the second fibroid relating to the posterior wall of the uterus, and then this is a pedunculated and is being pedunculated from the posterior wall of the uterus into the region of the right adnexa. You see, if this is the uterus, outline of the uterus in this scanning plan, then this is a pedunculated mass that is going posterior to the into the right adnexa from the posterior wall of the uterus, and the posterior wall of the uterus is not clearly defined in any scanning plan. So we see a fibroid in the uterus, in the posterior wall. Posterior wall is not clearly defined, or rather another fibroid starts from the posterior wall and then extends into the region of the right adnexa. Now it is giving very sharp posterior shadowing from the echogenic area in its anterior wall. This is the fibroid. This area is the fibroid. And if you see that this anterior portion is echogenic, and we see posterior shadowing from it, sharp posterior shadowing is seen from the echogenic area anterior to it. So fibroids can be anywhere, can be of any size, can be of any shape. Now F will denote a fibroid. Their size can vary, their appearances vary, their locations vary. So now when I move the probe further anterior up to the umbilical region, I see again a large mass that is extending. Now it is seen in the umbilical region. This is another mass, and it tilts towards the left side, giving an appearance of a left-sided mass. This I am seeing above the umbilical region and extending into the region of the left upper quadrant, with iliac vessels forcing posterior to it. These are the iliac vessels, and this is the fibroid, huge fibroid, big fibroid in the region of the, and then it extends to become continuous with the second fibroid that we saw here. See once again, here we saw the first one, here this is the first one, then this was the second one, this was the second one, and from here pedunculating Tilting towards the left side is a large, solid, burly appearance mass. This is also a fibroid. So there are three large fibroids. One is within the uterus, other two are pedunculated fibroids, and they are expanding and tilting. We have to see that if it is giving any mass effect on the left ureter, and if there will be any mass effect, we will see hydronephrosis in the left kidney. Now this is the left kidney. This is the left kidney, and there is no mass effect whatsoever, no hydronephrosis, so it's not giving any mass effect on the kidney. This is spleen, which is measuring 12.1 with a normal. Any mass effect on the right kidney? There is no mass effect on the right kidney. The right kidney is normal. This is the right kidney, and this is the liver. Liver is normal. So this is a case of multiple fibroids in a 40-year-old menstruating female, and the fibroids are, one is intrauterine, this one is intrauterine, the rest are pedunculated. This is a pedunculated one in the posterior to the uterus, and then there is another one, this one. This is a very big mass that extends from this solid mass into the right adnexa, then turns over to the umbilical region, then expands to the up to the left subcostal region. So this is the study of multiple fibroids, and the appearances of two are, one is hypoechoic, and the rest of two are showing heterogeneous appearance with echogenic areas giving posterior shadowing and hypoechoic areas as well. Thank you.